Hello world, my name is Dr. Sohom Das. I'm a consultant forensic psychiatrist and I live and work in London. I assess and rehabilitate mentally disordered offenders, or what the tabloids might call the criminally insane. I regularly assess defendants in courts and in prisons and in special, secure, forensic, locked psychiatric units that are reserved for the most dangerous and violent patients. Although I specialise in criminal psychiatry, I've also got expertise in most aspects of mental health. And this video podcast series explores a range of mental health topics. It's designed for the layperson who might be interested in learning a bit more about severe mental illness. And I'm talking about chronic, lifelong illnesses that can hugely impact on the sufferer's functioning. Illnesses like schizophrenia or bipolar affective disorder. I will analyse how some psychiatric disorders sometimes are related to offending, and I'll share with you a bit more about life from the perspective of a psychiatrist. And I'll reveal some interesting stories from my 15 years of working in this field. This particular podcast episode that you're watching or listening to, I will interview a young man called Usama, who's both an ex-psychiatric patient and also a future doctor. And after the interview, I'm going to deep dive into some of the issues raised, such as the stigma of mental illness, including my own experiences, and I'll also discuss the cultural factors which contribute to stigma in some specific ethnicities. Now, I'm afraid I have to apologise in advance because the internet connection during the interview is a little bit dodgy at times. I don't know what happened. It had been working all day and it seemed to choose the exact moment in time to go into malfunction, almost like an artificial intelligence that's designed to inconvenience me. But I'd like to thank George and Dan for editing the footage as well as they can. So sit back and enjoy, and welcome to A Psych for Sore Minds. So my guest today is Usama, and he has a unique story. He's now a final year medical student. In his first year in medical school, in around the middle of 2016, he had some serious issues with his mental health that spiraled out of control, and he was admitted to a psychiatric hospital. Due to a lack of beds, he was also moved out of his home area in London and relocated in Surrey. And he's also experienced periods of psychosis. So Usama, your story caught my attention because I think you've got a unique perspective because you're an ex-patient and a future doctor. So welcome to my podcast.
Thank you for having me.
It's a pleasure. My first question would be, were there any events or situations earlier in your life that you think impacted your future mental health?
Yeah, I think that's actually a really interesting question in that I'm quite privileged really to say that growing up as a child, I had a really good upbringing. My parents were fantastic, really nice place to grow up in and so on. So I think that anyone who kind of knows me from the outside quite superficially, I think would probably be quite surprised actually when they find out that, in the future I ended up having severe mental health issues, unfortunately. But nevertheless, I do think there are possibly three situations which I can think of which might have ended up impacting me in the future.
Okay.
And the first of those is when I was in year 9 of school. So I think about 12 or 13 years old at the time. And unfortunately, I had various schooling issues, basically. And what happened was that I had to change schools 3 times in 1 year, sadly.
Wow.
And I think, kind of growing up, the age of 12 or 13 is kind of when you begin to form these new sort of friendships and so on. And I think because I was interrupted so many times from me, I really quite struggled actually to come back from that later on. And I think in many ways that did end up having a massive impact on me in the future. So I think that would be the first situation. The second situation would be I was in my final year of school. So in year 13, doing my A-levels, and I just applied for medicine. And unfortunately, my medical school application went completely wrong, basically, in that I received 4 pre-interview rejections. And, as I'm sure you can imagine, as I'm sorry, as I'm sure you can imagine, that ended up having a significantly negative impact on my self-esteem. And I think that kind of followed me into medical school as well. So then that was my second point. Then my third and final point kind of happened at around about the same time as these medical school rejections. And that was, unfortunately, my granddad fell really ill. And he sadly passed away a few months after that. And, and I mean, obviously, there's no good time for anyone to pass away. But then, I think he kind of left at a time when I was just about to start the next chapter of my life. And of course, that chapter being medical school. And, I think I really struggled to come to terms with that. And I think even now I've probably not fully come to terms with it. But yes, I think those are possibly the three situations I'd mention.
Because I suppose starting medical school or starting any university course in itself can be quite daunting for a lot of people, can't they? Some people really look forward to it and take it in their stride. For some people, it's like resetting your entire life. So I can see how that'd be difficult. Mm-hmm. Do you mind talking us through a little bit about what happened when you first noted problems with your mental health? What kind of symptoms you experienced, what you were going through? Thanks.
Yes. So, I mean, despite my granddad passing away, I think initially I was actually really excited to start medical school because, I'd waited almost a year for myself to kind of get that offer. But then unfortunately, a few months later, in about January, I think, I just noted that my mood was getting slightly lower. And initially, I kind of ignored it because, as far as I was concerned, medical school should have been the best time of my life. And I was thinking that, if my mood is getting lower, there must be something wrong, basically. And I was not really willing to accept that, I don't think. So, my mood became lower and gradually became lower and lower over the next few months or so. And I mean, I think by about April or so, it just became dangerously low to the point that, I just felt really numb to everything. I started experiencing symptoms of psychosis, for example. And then eventually it just got so low to the point that sadly I felt suicidal. And eventually by about May, I was unfortunately one day walking outside Lord's cricket ground, just as a way to kind of, and take my mind off everything. But then I think my mood was so dangerously low that day that essentially what ended up happening was that I had to be taken by ambulance to a psychiatric facility in London. And from there, I was looked after there. And I'd like to say things got better straight after my discharge, but I don't think that's strictly true in that I was kept safe in the psychiatric facility until I was stable, I guess. Okay. But then when I was discharged, the low mood kind of continued for a long time. Yes, it was a combination of really low mood combined with psychosis, essentially.
So you touched on your hospital experience, and I'd like to go back to that later. But before that, I was just wondering, while you were going through these experiences, low mood, suicidality, psychosis, how much of an insight did you have at that time? How much did you know that something was wrong?
Yes, good question. So initially, when my mood was slightly low, I had insight into that my mood is low, I'm not really enjoying things as much as I used to, and so on. But then I think when I became really, really numb to the point that I had psychosis, then I had pretty much no insight, actually. So if I talk a bit more about that. So when I did become really, really numb, it sounds quite funny, but what happened was that essentially I almost became convinced, basically, that I was almost no longer alive, basically. Right. And I mean, the thing is that when that ended up happening, I was just so convinced of that fact that even whenever people would offer to help me, for example, in my mind, I was thinking to myself, why are they trying to help me? Right. It makes more sense to help people who are actually alive as opposed to someone who's, not living, basically. And I mean, I know it sounds really strange, but that's kind of to me, it sounded so logical at the time, but obviously to others, it did not sound that logical. And then later on, unfortunately, I started hearing some sort of voices as well. So, they'd be saying things like, you're useless and you're worthless, you don't deserve to be at medical school. Wow. And I don't think I ever really kind of realized that these voices were not my own, basically. They kind of sounded really, the classic example at medical school is they sounded as though someone was sitting right next to me and talking to me. Yeah. And I would respond to those voices in different ways. I'd either get very angry at them, very upset at them. But to me, the responses seemed perfectly justified. because to me they seem so real. But then unfortunately to others, it kind of ended up scaring them in many ways, sadly.
Well, okay. And what was your general level of functioning like around that time? So were you getting up? Were you going to lectures? Were you able to look after yourself? Were you going shopping and cooking and stuff? Or no?
No, absolutely not. I was not able to function at all at that time. I just remember that I'd literally stay in bed all day. I would not go to any sort of lecture or anything like that. I wouldn't cook for myself. And I mean, basically, I was just not looking after myself in any way at all. I was completely unkempt for a long time. And I think in many ways that almost led to a vicious cycle, in that my mood would be low, I wouldn't be looking after myself, and that would further end up lowering my mood as well. And the cycle kind of just continued like that, and it was very difficult.
Yeah, it sounds horrible, really horrible.
Mm.
And in terms of, apologies in advance, quite a personal question, but in terms of the suicidal thoughts, how far or how deep did they go?
So they got very deep at times. I do remember, I think if I talk about the deepest time that it ended up happening, basically what had happened was that one night, so this was a night where I was basically walking outside Lord's, and when I ended up admit in the psychiatric unit. So as I was walking around there, my mood basically became so low to the point that basically what happened was that I literally could not see any point in continuing anymore. Wow. And I mean, I hope this is not too triggering, but they were basically cars, cars. They were driving really fast in front of me, and I had this massive thought to basically jump in front of those cars. Wow. And what happened essentially was that in the end, I basically on my phone, I basically wrote a note to my family and said that I'm really sorry about everything. And yes, I was very lucky there were people around me at the time. Actually, I think someone ended up calling me an ambulance, and from there I was taken to the psychiatric facility.
Wow, that's really scary, isn't it? So it really
horrific
situation to be in.
Mm.
So presumably there must have been something inside of you that was kind of stopping you, some kind of inner voice that must have been battling everything else.
Yeah, yes, there definitely was some sort of inner voice. I honestly can't really explain what it was, to be honest. I mean, yes, you're right in that thankfully I'm still here and still alive and everything. I guess in many ways, I have a very supportive family around me. And I think after I did write that note as well, I kind of thought about them as well. And, I just thought about how upset they would be. And I think in many ways it was thought of upsetting my family in many ways, which kind of prevented me from essentially taking any action, I think.
Yeah. Okay. Well, I'm very glad to hear that it did. In terms of your hospital experience, how was that overall? How long were you in for, first of all?
So I was in hospital, I think, for around 2 weeks or so, I think.
Right. And how was it?
Yes. Actually, it was. I'm very happy to say it was a very good experience. Initially, it was very scary because you mentioned earlier on that I was transferred all the way to Surrey, and now I was being told basically that you have to go to a part of the country that you've never been to before, that's far away from home, and that was really scary, I think, and I felt really vulnerable and really scared. But then I'm very lucky because, as I said, the team there were absolutely fantastic. I mean, the psychiatrist who I had, he probably had the best patient management I've ever seen, both in my time as a patient and in my time as a medical student as well. The nurses were fantastic. So, I mean, they made sure that I had suitable food, for example. They basically made sure that all the food was essentially, that all the food met my dietary requirements. The healthcare assistants, they checked up on me every hour or so, if I remember correctly. And again, they were very friendly. So I think that because the team were so excellent, the fact that I was transferred so far away, it did not really end up mattering too much in the end. Okay. But that could well have easily gone in the other direction, I think. Sure. In that, I think even if the team was just adequate or good, I think it could have gone completely wrong.
Firstly, it's nice to hear somebody talk about a positive experience of being in psychiatric hospital, because I hear a lot of negativity, which I think there's probably a bias because a lot of patients go into hospital. Sometimes they're detained against their will. They're almost always at their lowest ebb. So I think that a lot of people don't have a good experience, and that's a story I'm very familiar with. So I'm glad that you did. It's probably slightly different for you because your hospital admission was 2 weeks, but working in forensics, I've certainly seen a lot of patients that have been out of area for months, if not years, because their beds in their local area are full. And it really impacts their rehabilitation, their recovery, because for a start, they can't get visits very easily from their friends and family. And again, for 2 weeks, I imagine that's not quite the same kind of issue, because if you somewhere for months or years, then it means you don't get to see family for weeks at a time. And also it means they don't know their home area, so they can't go out and rehabilitate by doing voluntary work and kind of getting back in the community. And so you obviously quite open about your experiences. Is that correct? You spoke to your peers and your friends about it. How did that go?
So, yeah.
How did it go?
I mean, look, Dr. Das, I do remember thinking back to year one. I was very upset actually at the responses from some of my peers when my mental health did start to deteriorate. And I think the best way to kind of illustrate why is if I explain how I was treated by them when I had a physical health concern compared to when I had a mental health concern.
Sure.
So again, if you rewind back to my first year, around January of first year, I think, I had unfortunately slipped a disc in my back. And essentially that rendered me immobile, I think, for at least a week or two, I think. And I mean, the response that I got from my peers back then was really, really positive. They'd all basically offered to do my shopping for me, offered to cook for me, sent me really motivational messages and so on. And it was actually a really lovely response from them. But then if you just fast forward a few months after to when my mental health became really, really low, the response from the same people was almost the exact opposite in many ways. And I think when your mood already is that low, to kind of get that response only serves to make that low mood even worse, basically.
So do you think that, stigma, we're talking about stigma here, aren't we? Do you think the stigma that your peers had was just born out of ignorance? So did they assume that you would be different or difficult in the future? Or where did it come from?
Yes, I think in many ways it was unfortunately out of ignorance. I mean, the example with the physical health issue kind of shows that, they are actually quite helpful people. But I think that unfortunately, because, as I said, there's such a lack of education towards mental health, it kind of leads to a lot of ignorance. And of course, there's also lots of negative stories about mental health in the media. Yeah. I mean, there's people unfortunately associate mental illness with violence, for example. Yeah. I think in many ways, because of the negative attitudes towards mental health and the lack of education, people end up feeling quite almost scared, I think, towards people who have mental health issues. And I think, unfortunately, my peers kind of fell victim to that in many ways. Yeah.
I absolutely agree. I think that some portrayal of mental health in the media is a massive problem. I think maybe the tide is very gradually turning. So, even in the last 20 years, you've got a lot of celebrities that have come out that talk about mental health issues. It's a bit un-PC now to use certain terminology that you could have used a couple of decades ago. But it's still a very, very slow process, because it's one thing people, on the surface talking about something, and it's very different for the whole of society to accept.
Definitely.
The other thing that I've always thought is that there's a voice for people that have had a little bit of anxiety or a little bit of depression and have recovered, and a lot of celebrities talking about that, which is good. It's a good thing. But there doesn't seem to be much of a voice for people who have become really mentally unwell, who, for example, had to go to hospital. I think that's still a kind of a shadowy world that people don't like to talk about.
I would definitely agree with that. And I think that, it's obviously really good that people are open with things like depression or anxiety, for example. But I think I definitely agree with you in that I think even among people who kind of experience depression or anxiety, not many of them really know that things like schizophrenia or psychosis, for example, exist. Absolutely. And I think even amongst that population, sadly, people with schizophrenia, psychosis, bipolar disorder, for example, they are very heavily stigmatized still, unfortunately.
I agree, absolutely. Another interesting aspect of stigma from my clinical experience is that it can vary between different communities. Obviously you come from an Asian background. Do you think that made a difference? So another way to ask that question is, do you think that your your community and your family and your culture thinks about mental illness in a different way than sort of mainstream white British backgrounds might do.
Yes, unfortunately, I do think that there is more stigma within the Asian community towards mental health. I mean, in my case, for example, I actually did not tell my parents about anything until I was actually admitted in the psychiatric unit. And I'm very fortunate because my parents had a very positive response towards everything. And that ended up taking me by surprise, I think, because of the stigma within Asian communities. I was expecting a very negative response from them.
And so looking back at it all now, do you regret being as open as you were to people in general, to your peers, or do you think it was the right thing to do, or how do you feel about it?
That's a very, very good question, I think. And I mean, I don't like to say that I regret anything because I do feel like I learned a lot from those experiences. In terms of being so open, in hindsight, perhaps I would not have been so open with absolutely everyone, because obviously I know now what the response would have been. I feel like some people almost do not really deserve to know that in many ways because of the way that they responded.
So from what I understand from talking about you before, there was a bit of a delay in you being seen by the community mental health team after you were discharged from hospital. So I'd just be interested to know, please, how long was that delay and how did that affect you at the time?
Yes, so the delay was 9 months in the end. So it took 9 months for me to be seen after my psychiatric inpatient admission. And I mean, that was, I think, really, really difficult for me to deal with because initially I was in a psychiatric inpatient facility. I was in a facility in which I was surrounded by healthcare professionals, basically. And if anything happened, I knew that there were people around me who could basically come to help. And then now suddenly a few weeks later, I was in a situation where I was in the outside world and I had no healthcare professional around me. And that was very, very difficult for me to deal with, and especially for 9 months. Yeah. I mean, I do remember in those 9 months, actually, unfortunately, there were, again, various episodes where I'd feel really low, suicidal, some episodes of psychosis. And unfortunately, I would end up going to A&E several times, I think more times than I can remember, actually. And I think A&E is actually a very scary place to be as a mental health patient as well. You know, it's very loud, very bright and everything. And in many ways, that ended up worsening my mental health as well. So yes, it was very scary. You know, I think a lot of those A&E trips could have been avoided had I been, had the referral happened a bit sooner. So yes.
Well, I think 9 months is just far too long. I can understand that there are delays, there are waiting lists, but 9 months for somebody that's in with, you know, serious depression and psychotic symptoms, that's just too much. I'm used to that. So I work mainly in courts, and sometimes we try and arrange outpatient appointments for our patients who are almost always in crisis to have gone through the criminal justice system in the first place. And sometimes the waiting list is several weeks, and for me, that's too long. So 9 months is the whole different ballgame.
Yeah, 9 months was very difficult.
And I often hear teams say to patients to go to A&E if things are getting on top of them to the degree that they're seriously contemplating self-harm or suicide. It's kind of like the go-to solution. But as you voiced yourself, it's just not an ideal scenario at all. From my experience, from even being the doctor that assesses the patients, I've been there where there's been such a long queue of people for me to see that patients wait for several hours before they get seen. They're in a very uncomfortable environment. It can be loud, it can be noisy. Sometimes they are actively psychotic, for example, and it's just not ideal in my view at all. So, Usama, I've heard that you've had quite a positive experience with your community psychiatric nurse. And is it a he or a she? He's very helpful. Can you please talk me through what made him particularly helpful? What character traits or what in what ways of working were particularly helpful for you?
Yeah, sure. So I mean, my CPN was absolutely fantastic. I mean, I do remember whenever I feel happy, he'd be there to almost be happy with me. If I feel sad, he'd be there to be sad with me, and so on. And I think in terms of characteristics that he had, I think that the most important one was that he was very, very non-judgmental, I think. In that I could literally say pretty much anything to him, and he would never ever judge me in any way for it whatsoever. And I think as a mental health patient, you very much need that because of all the stigma, that we've kind of talked about. You kind of feel very vulnerable, basically, and you kind of need someone who you can be so open to. And because he was so non-judgmental in that way, it was very easy for me to do that. So I think that's the first characteristic that I would describe.
Yeah.
The second characteristic is that I think in many ways he kind of treated me more as a friend as opposed to a healthcare professional. And don't get me wrong, I do understand that, you do need to have some sort of boundary between the health professional and the patient. But what I mean is that he basically put me in charge of everything, and that he would never dictate anything to me. He'd always ask me, as to basically whether or not I thought it would be a good idea or not. And I mean, we're taught a lot about patient-centered communication in medical school. And I think it's only really by being a patient where you kind of realize just how important and valuable that is, really.
Yeah.
Especially as a mental health patient, where, as I said, you do feel kind of as though your basic liberties have basically all gone. And to then have some sort of control is very, very important, I think. And the third point is that from day one, he said to me that he'd pretty much be there for me. And I think that's the easy bit. But the hard bit is that he actually acted upon that as well.
Yeah.
In that whenever I felt as though there was some sort of crisis or something, I felt as though I could easily message him and he would arrange an appointment for me either that day or the next day. Wow. And to kind of have that sense of security behind me was something which really did benefit me as a mental health patient.
Yeah, it's just very refreshing to hear that, because as I said before, I've heard stories of people really struggling to get any contact, not just with their community psychiatric nurses, but with the whole team, with the appointments with psychiatrists, etc. So I think it's so important.
Shame, yeah. I mean, I think it's a real shame to hear that, because, as I said, my experience was really positive, and I kind of know just how much of a difference that made to me.
Yeah. Okay, so going through this whole experience, as you'll be a doctor next year, is that right?
Yeah, hopefully, yeah.
Do you think it's impacted the way that you deal with patients or look at patients, both psychiatric and non-psychiatric, in the future?
Yeah, I mean, I'd like to think that it has impacted me in that I have a very good idea now of what it actually means to be on the other side and to be quite scared and vulnerable as a patient as well. And I mean, I think on many placements, for example, I do quite like to sit down and spend a bit of extra time with patients, kind of talk to them, not just about medicine, but about other things as well. Because I think as a patient as well, that actually is really helpful. Yeah. And I mean, whether or not I'll have time to do that in the future is something which, remains to be seen. But I do hope that I carry on in that regard as well. I mean, there are some slight negatives as well, though, unfortunately, of it as well. And I think the key one is that when I do think back to my psychiatry placement a few months ago, in many ways, I saw myself in many of the patients. And I think that was quite difficult, because when I go home at the end of the day, I would find myself feeling quite upset, for example, about many of the things that I saw. And so I think what I have struggled with a bit more since my experience is kind of distancing myself from patients. And I think hopefully with experience, I'm hoping that I can kind of help address that problem.
Okay, it's nice to hear that. Although it's a mixed and complicated bag, it's nice to hear that something good came out.
Yeah, and I do hope that overall it should be a positive experience.
I completely get what you say when you talk about spending time with patients, because especially when you're assessing patients for the first time, especially in a busy environment like liaison psychiatry, for example, you're in a very bizarre situation where you're talking to somebody that you really don't know about very, very personal things. You're asking them about, for example, suicide attempts was very common when I worked in liaison psychiatry. So right off the bat, you're asking them about very personal issues, about thoughts of wanting to kill themselves, about things that are going on in their lives, their relationships, their problems with their work within minutes of meeting somebody. So it's a very bizarre kind of power dynamic. And I think that actually part of the way to deal with that is, as you say, to just talk to people for a while and just get them comfortable with you. But it's also a matter of timing, isn't it? So if you've got 4 or 5 patients waiting in A&E, then it's a lot harder to do.
Definitely.
So my last question, Usama, would be, have you got any advice or tips for anybody who's been through a similar experience as what you went through? So either a young person or a student that's going through a mental health crisis?
Yeah, so I think the biggest piece of advice that I'd like to give is to please ask for help if you feel as though you need it. I mean, I know it can be difficult, especially when your peers around you might not be the most understanding, but there are lots of services out there, like, the Samaritans. You can talk to a personal tutor, for example. And I mean, in my case, my personal tutor was absolutely fantastic. He was very supportive from day one. And I think more specifically for medical students, I think medical students often worry about things like fitness to practice, for example, with mental health, and that's why they don't open up. But I can say in my case, I don't think fitness to practice has ever come up, as any sort of issue for me, which is really, really helpful. I think in general, medical schools are looking for two things. And the first is to show that you kind of have insight or some sort of awareness into your condition. And the second is to kind of show that you're actually trying to get some sort of help as well.
Yeah.
And I mean, even if you can't quite do one of those two things, the medical school will still do all they can to kind of support you as well. I mean, I myself had practically no insight, as I mentioned, in my first year, but my medical school really did support me to kind of help me adjust back into normal life and adjust back into medical school as well. So yes, my key piece of advice would be please do ask for help.
Okay, that's really helpful. It's really interesting talking to you, Osama, and I'm very grateful for you sharing your story. And I'm glad to hear that things have worked out for you. I know you went through obviously a very difficult time, but it sounds like you managed to readjust and continue with your life. And I wish you all the best in your future studies.
Thank you very much, Dr. Das. I really enjoyed it.
All the best.
Okay, take care.
There were a couple of issues that Osama mentioned during our interview that I'd like to expand on. The first one is stigma within the medical profession, let alone wider society. I've literally seen this from some doctors a few times in my career, and I've always found it shocking. Now, obviously, I'm only talking about a small minority of medics, but it shouldn't happen at all, in my opinion. You shouldn't go into a caring profession and dedicate years or even decades of your life studying and training if you lack basic empathy for the disadvantaged. I think some doctors see psychiatric patients as difficult and challenging, and they assume that they're troublemakers. As a brief example, I remember when I was working in liaison psychiatry as a junior doctor, and there was once a schizophrenic patient on a fracture ward. He'd broken both of his legs jumping out of a 4th-story window during a failed suicide attempt. And this man was clearly unwell. He was actively psychotic, he was hearing voices, he was just generally agitated, and he was constantly trying to get out of his bed. Now, to be fair, he was challenging to the staff working on the ward. He needed a high level of sedation, and he had to have an RMN, which is a registered mental health nurse, sitting next to his bed 24 hours a day on one-to-one observations. But I heard the orthopedic surgeon in charge of the ward use some very derogatory terminology on a couple of occasions. He called this man loony, and he referred to him as the crazy guy. Now, I kind of get that the surgeon was probably very busy and he was working under constant pressure, and there's, a lot of operations to do in a short period of time. And I assume most patients are probably compliant and low maintenance, but this schizophrenic man was everything but those things. So I suppose I can understand that doctor's perspective and his frustrations, but I just think the language it's just unnecessary, and it's damaging, and it just all contributes to the stigma of mental illness. So me and him had words, which, to be honest, was quite intimidating for me, because it was his ward, his territory, and his medical team. Again, I don't think that's the case for the vast majority of doctors, but I've maybe seen it on 4 or 5 occasions in my career, but in my book, it should be 0 occasions. Now, I'd like to tell you about another slightly obtuse form of stigma within the medical profession, something that you might not necessarily have been aware of, and that is that some doctors stigmatise psychiatrists. So I've certainly had comments in my career about not being a real doctor. All psychiatrists in the UK have to qualify as doctors first. So we have to attend medical school, we have to pass all the grueling exams, and then we have to work for a minimum a couple of years across different settings in a few different types of wards in different hospitals. Just like all doctors, we then, after that, get to specialise in one chosen field. So personally, I've worked as a doctor in accident emergency, in urology, in ENT, and in intensive care. I did all that before I exclusively worked in mental health. Psychiatrists are often mistaken for psychologists, which is a very different career paths. So psychologists don't do a medical degree and they don't have the basic cross-sectional kind of junior doctor level knowledge or experience of working in different fields of medicine. I think I might expand on the difference between psychologists and psychiatrists in another podcast episode. But some doctors feel that psychiatrists, such as myself, don't retain the basic medical knowledge or skills for physical health issues. And to be honest, I think there's probably a grain of truth in that. I mean, if you don't use a skill or if you don't use knowledge on a day-to-day basis, it kind of depletes over time. It's natural. But conversely, I would argue that we psychiatrists offer a different skill set to society than other doctors do. I'm not just talking about the obvious one, which is the treatment of mental illness, but also supporting the most vulnerable, challenging, and I would say damaged and even treatment-resistant patients. Next, I wanted to talk about the stigma of mental illness in certain specific ethnic groups. And we can't really talk about that without acknowledging the racial inequalities within the mental health system. And we must recognise that there's a higher incidence of certain mental illnesses in certain communities and ethnic groups. So, for example, there's a much higher incidence of psychosis in black males. And as a side note, black men tend to be medicated more often than their white counterparts, rather than, for example, being offered talking therapy. And black men also tend to be disproportionately detained under the Mental Health Act. And they also tend to be brought in by police more often to mental health services. So there's a lot of inequalities, and I think that they're beyond the scope of this particular podcast, and maybe I'll do a session about that in a future episode. Incidentally, I was on a podcast named Your Next Episode in about, I think it was mid-June, and I was talking about this exact same topic. So the title of that episode, in case you want to check it out, was Racism and the Criminal Justice System. And if you're interested, the link is below. Now, back to the topic of stigma within certain ethnic communities. From my experience, one big factor is the conceptualization and like the beliefs behind the causes of the mental illness themselves. So, for example, some Asian and African communities believe in black magic, and they believe that what we would call psychosis, hearing voices, are actually spiritual experiences, or that the sufferer is being possessed. Sometimes they search for religious intervention rather than psychiatric treatment. Now, I don't have a problem with this in theory if it's a relatively mild mental disorder and if it can be contained and managed in that environment. I think that it's the choice of the sufferer and their family and the community around them. But the problem is there's a lot of cases where it's actually quite severe mental illness, and delaying treatment without the proper medication and the proper support from services gives the illness time to fester and deteriorate, and ultimately it's the patient that suffers. Another factor in many ethnic minorities is embarrassment. It's almost kind of seen like the fault of the patient for suffering from these mental illnesses, some kind of perverse karma. And it brings shame to the whole family. And so it's kind of hidden. It's like swept under the carpet. A good example that I remember is when I worked in a medium secure forensic psychiatric ward when I was a specialist registrar. And I treated this Asian man who had quite severe Asperger's syndromes. And then he developed a psychosis on top of this, and he became very paranoid. But instead of seeking professional help, his family actually made him live in like a shed at the bottom of the garden. But they hired this kind of like assistant man who cooked and cleaned on behalf of the mentally ill person and who would take him food a couple of times a day to his shed. So the man with Asperger's became increasingly paranoid and believed that this assistant wanted to kill him. So he actually attacked this poor man with a hammer. So my point is, when it's severe mental illness, such as florid psychosis, there's no way around it. It needs treatment. Another interesting scenario that I've seen on around 3 or 4 occasions in my career is that within some Asian communities, men with mental illnesses are married off in arranged marriages, and the family brings across a bride from Asia without letting them know about the psychiatric issues and trying to cover them up. And I think that the women and their families are kind of grateful to a degree, grateful to have an opportunity to move over to the UK. But then, predictably, the symptoms of mental illness eventually surface. And I think this is quite a damaging tactic because, let's face it, it's very unlikely that there's going to be a stable, lifelong relationship. I think in every single case that I've seen of this particular scenario, there's eventually been problems down the line and the couples have split up. I've never seen a happy ending, I'm afraid to say. Another issue that I wanted to talk about is that a lot of celebrities have opened up about mental health problems, which I think contributes to decreasing stigma, from Prince Harry to Kendrick Lamar to The Rock. And I do think it helps destigmatize and demystify mental illness, but it's only some mental illnesses and it's only to a certain degree, because most famous people usually talk about relatively mild illnesses like depression or anxiety, and it's usually in the context of them having overcome them and having like this story of recovery and redemption. But there seems to be little equivalency for the more severe, less media-friendly types of illnesses, not just extremes of normal emotions, but illnesses that have symptoms outside of reality, like schizophrenia. Although, to be fair, there are not many famous people with schizophrenia. One exception would be John Nash, who's an American mathematician who won the Nobel Memorial Prize in Economic Sciences in 1994. I think by having some mental illnesses publicised but not others, there's a risk that patients with the more severe mental illnesses might end up paradoxically, love that word, more marginalised and more stigmatised. As you might be able to tell, I'm relatively new to this. I've only been making podcasts for a few weeks, and my plan is to release one episode a week, both a video version for YouTube and also an audio version, always released on a Tuesday. I've got tons of fascinating stories, and as a forensic psychiatrist, many of them are related to horrific offences and blood-curdling violence, but some are not. My patients are some of society's most vulnerable, often with just shocking backgrounds like all forms of abuse or drug addiction. But I've also witnessed some heartwarming tales of people who were once considered by some to be the dregs of society, who've overcome almost impossible hurdles and shaken off the shadows of their pasts to go on to live fulfilling lives. And I wanted to give those patients a voice. As well as a forensic psychiatrist, I'm also a medico-legal expert for civil court work. So I've undertaken a whole range of cases like historical sexual abuse, which has led to post-traumatic stress disorder. And also I've assessed dozens of survivors of the Grenfell Tower fire. I'd like to share some of my stories with you because I think we can all learn something about the human condition and about resilience in general, regardless of whether or not we suffer from a mental illness. For the next episode, I'll be talking about personality disorders. I'm going to tell you the definition. I'm going to go through the details of some of the common types, such as antisocial personality disorder and borderline personality disorder. Now, you may have heard these terms, and I certainly see a lot of them in my clinical practice. And I'm also going to be discussing how they can link to violence sometimes and even suicide. And I'll also tell you how we treat personality disorders. I'm always open to ideas, so if anyone has anything they want me to discuss, then hit me up on Twitter, comment on our Instagram, or you can just old school email us using psychforsoreminds@gmail.com. I know that Beth, my very hardworking podcast promoter and producer, wants me to do an AMA on Reddit as well, so look out for that. If you have any questions related to psychiatry or mental health, I'll be happy to answer them if I can. If you do like this content, please do hit like and subscribe. It really does help build up a momentum, and it helps me decide whether to keep going or not. So that's all for today. Hope you enjoyed it. Thank you for bearing with me. And again, apologies for the dodgy internet connection during the interview. Until next time, stay euthymic, homies.